Hello, conference. I'm delighted to be here. The SWAN conference gets better and better every year, and I'm delighted to support that campaign along with all of you. This session's called What Happened to Anti-Racist Social Work, and I've entitled my 10-minuter, Is the anti-racist effort a luxury we cannot afford in a time of recession? Provocatively, of course. Recently, we've been invited to consider notions such as the demise of anti-racism, the defence of multiculturalism, the post-race society. Lots of arguments and debates have emerged within social work that focus on re-theorising and reorienting the anti-racist effort in the light of social demographic change, the rise of Islamophobia, the shift from single to generic equalities legislation and measurement. A number of propositions have been put forward by ourselves as academics by way of explanation for the apparent demise of the anti-racist effort in social work. It has been argued that it's theoretically out of step with the current complexities of contemporary multicultural identities, that it's been overtaken by bureaucratic incorporation and become a matter of organisational competence pushed by the developments in equalities legislation, that a new public discourse has emerged following the events of 9/11, in which race, community, faith have become dangerous narratives in public policy circuits, and/or that the logic of neoliberalism and at times increased austerity mean that the luxury of a single issue politics is no more, and that the brief has to become muted in the clamour of competing concerns and priorities. Anti-racism is so 1980s, I've heard it said. And we are left puzzling now on where to look for the locus of change for the anti-racist effort, as the institution of social work appears to have moved on. This is indeed a strange moment for us, a paradoxical moment in which our conscience is still pricked when reminded about the pervasiveness of racism and its effects. We've just heard, still pricked when reminded of the social justice ambitions of the profession, and yet anti-racism, now largely redefined as cultural competency, has been reduced to a set of technical skills for practising with black and minority ethnic individuals. And why is it that in times of recession, social movements, contrary perhaps to expectations, dissipate, lose momentum and focus, lose out, when we should be angry, when we should be discontented, when we should be at our most vociferous? We are not. What are the effects of this recession on us as black workers and service users? How does the recession reverberate with anti-racist equalities efforts that we are making? What type of revision does it imply to our professional mandate on social justice? Whose business, anyway, is anti-racism? Possibly our discussion later will address some of those questions, but I just wanted to lay down a little bit of ground here. Perhaps some less rehearsed explanations for the current lethargy are what has happened to us as black workers and activists in terms of the impact and the costs on us of the anti-racist effort. What is happening to our third sector organisations? Why is there such a silence around the neutrality of the white liberal value base? Recession in Britain commenced in 2008, and back in September 2010, as recession began to take its grip, Diane Abbott put forward the claim that the planned government cuts to public service would hit black and ethnic minority workers much harder than their white counterparts, as a higher proportion of their jobs were in the public sector. In March of this year, the Afia Trust published their interim report, Living at the Margins, which looked at the impact of local government, of the cuts in local government social care budgets on BME communities. And they note that in England, around 3 million was cut from the BME voluntary and community sector organisations in 2010 and 11, of which 1.5 million was in London alone. If we look at the evidence from the Equalities and Human Rights Commission, they've put out a document called The Equality Impacts of the Current Recession, and there's evidence that has been put forward by McQuaid and colleagues entitled The Impact of Reduced Public Services Spending on Vulnerable Groups, a review from the UK. We can see that there are 3 potential effects of recession. Firstly, job losses and the workplace experiences in the public sector for us as black workers. Personal social services staff in social service departments, that is, social workers, employed 216,000 full-time equivalents, and 84% of that group are white, and around 10% are known to be from black and ethnic minority groups, with about 6% don't knows and knowns. 10% of staff in England whose ethnic origin was known were of black and ethnic minorities. I'm speaking specifically about social work staff, not the vast army of social care staff, amongst which we know people from minority ethnic backgrounds are highly representative. A higher percentage of social service staff were of black origin than whereas a lower percentage were of Asian origin. In inner London, 46% of staff are from black and ethnic minority organisations. And it's very interesting to note that 8 of the inner London boroughs have high percentages of staff known to be from black and ethnic minority groups. For example, Brent, 63% of staff are from ethnic minority groups, and in Hackney, 59%. Outside of those 8 boroughs in London, the highest authority with black staff is in Birmingham with 40%. The trade union note that ethnic minority groups may not have been adversely affected by the current recession because of their concentration in the London boroughs. That was fairly early on in the recession. However, it is clear that in the last quarter of 2008 and beyond, ethnic minority employment was greatest in industries dominated by the public sector, and as a result, they are more likely to be subject to job losses. Public sector cuts also affect the third sector, as these organisations are sometimes heavily funded by the public sector and are increasingly responsible for public service provision. The effects of reduced public spending will cut across sectorial boundaries. This broad picture belies the subtle day-to-day patterning of pressures and systematic discriminations noted by black social workers in their day-to-day work. Secondly, in terms of access to services, we know that cuts to public service budget will potentially affect equalities groups in a number of ways. For example, the tightening of eligibility criteria in health and social care. And this may mean that those with more acute needs will have less access to services. It also implies an increased role for informal care, for families and for friends, and highlights the issue of the disproportionate impact on women from ethnic minority backgrounds. BME third sector funding, as I have described, is severely cut because much of their income is derived from grants, because they have employment responsibilities, and because they have very few reserves. And thirdly, the potential impact comes in terms of welfare and tax cuts, income support and poverty. And you've seen from Danny Dorling's presentation how hard that impact is being felt in terms of just one benefit, the family working tax credit. So, at this time of job cuts and loss of services It's a moot question to ask whether advances in government policy, such as equality legislation, equality policies, the minimum wage, tax credit policies, or rights to flexible working, will have mitigated some of those effects. These strategies may have cushioned some of the impacts of recession for some categories of minority groups. At the same time, there's evidence to suggest that organisations have become more sluggish in undertaking equality impact assessments. The AFIA Trust research found in their survey that 1 in 5 adult social services departments do not collect data on the funding allocated to BME organisations or conduct equality impact assessments. So whose business is it if it's not ours? How can resistance to this situation be mobilised? One of the lessons from the radical moment on race in social welfare was the serendipitous coalition between the recruitment of black activists into the ranks of the social service workforce, including social work education, and their efforts as they engaged with grassroots groups. These catalysers, as I have called them, commanded a forum within decision-making bodies in social work at a very critical moment when the white liberal conscience was amenable to pricking. But their encroachments within the corridors of power were short-lived, and they have steadily been eroded by a plethora of strategies, picking them off the discrediting tactic, playing them off the divide and rule tactic, and reshaping of the moral mandate, the switching of the discourse tactic, such that particularist pleading is translated as narrow, selfish, short-sighted, segregationist, conservative, and even traditionalist. Current policy and practice have successfully changed the terminology, changed the rules of engagement, changed the priorities and the perspective. A variety of downward pressures have disabled us. 2 minutes. Okay. Just to say a few concluding words then by way of summarising my last few points. I'm asking the conference, therefore, if the white liberal mantle has moved on, where is the locus of change for anti-racism? Will it be with the College of Social Work, with the Health Professions Council? How will they respond? The literature cites heavily the neoliberal methodologies that make us too busy, too distracted to incorporate the race effort in our day-to-day occupations. Isn't it more the case that the profession has never found this position comfortable because of what it implies for the liberal value base? Isn't it that they have relied far too heavily on the energy, passion and emotional commitment of black people themselves? Anti-racism is not a luxury, and if we've got time, set of tasks, a special effort. It is the core of our primary business of rectifying injustices, of combating disadvantage, and of speaking truth to power. We find ourselves in a moment when our models of analysis have proved wanting, when policy has failed those we seek to serve, but when there is considerable uncertainty about the way forward and considerable disagreement about what the appropriate models of analysis and action should be. For me, the task now is not one of speculation, but of identifying an acceptable framework for analysis, policy and action. Thank you for listening.